My name is Rauda Tellawi, and I'm an obstetrician and gynecologist for Johns Hopkins Community Physicians in Howard County. Mental health is so important in pregnancy because I like to tell my patients they are not just a uterus and ovary. They're not ovaries, they're not just a vessel carrying a baby, they're a human being. And somebody's mental health status can make or break their pregnancy and their postpartum period. It can make it a nightmare, or it can make it pure joy, even if it's a complicated pregnancy. So when I talk to my patients, we have a strong discussion about, their personal mental health history and their family mental health history, because some people may not have had any issues themselves, but there can be something strong that runs in the family, and then pregnancy and postpartum periods expose it. So for those patients, or any patient with any sort of, mental health background, like any mood disorder in the past, any history of bipolar disorder, depression, anxiety, schizophrenia, sometimes embarking on a pregnancy can be a very scary thing because they're very worried that it's going to go downhill. So we start off with a discussion about where they stand right now. I start off with talking about what medications they're on or what they have used before, what has worked for them, what hasn't worked for them, what therapy has worked for them, what their safety net at home is and what their support structure is, what their backup plan is if things do start going downhill. And we try to help create a whole system for them, a whole safety net to help guide them through the pregnancy and the postpartum period. I really try to emphasize to them that we're here for them every step of the way, and that we're not just here to check a baby's heartbeat, we're here to make sure that they are doing okay through this whole pregnancy. And if we can, aiming for okay is a good aim, but I like to aim for happy. So the goal is to make sure that they get through this as smoothly as possible, with whatever support that we can provide them. So for most of my pregnant women, if I can easily manage their mental health care throughout the pregnancy, I at least initiate their care and titrate their medications as much as I need to, or I help get them into therapy. But if something's appeared a little bit more complicated and they need a little bit more attention and specialty care, I send them immediately to the reproductive psychiatrist. A lot of their practice focuses on women through puberty, pregnancy, postpartum, and the menopause transitions. Postpartum, we keep a close eye on our patients. So for all of our patients, we see them at least 4 weeks postpartum. But if somebody has a history of anxiety, depression, bipolar disorder, we actually try to see them 1 to 2 weeks after delivery, in addition to the 4-week visit, and then again at 12 weeks. And these patients, I encourage them to call us in the middle of the night if they are not doing okay. For us, it's not just about vaginal bleeding and contractions. I'm having a breakdown and I need help, and that for me is just as big of an emergency as vaginal bleeding in a pregnancy. So we do our best to help them through this during pregnancy and the postpartum period. So something that a lot of people don't realize about pregnancy and postpartum is that your partner gets affected too. And this actually it applies to partners where it's a heterosexual relationship or even a homosexual relationship. The partner who's not carrying the pregnancy actually can develop a mood disorder, just like the person who is carrying the pregnancy. So for example, one statistic that most people don't realize is that 10% of fathers experience postpartum depression. In reality, that number is probably a lot higher because it can be very hard to convince some people to go see a doctor and actually get this diagnosed, and it doesn't look the same way that depression does in a woman, for example. Men can present very differently. So something very important is that when we educate patients in a pregnancy, I like to make sure that the information is getting passed on to their family. So I love it, before COVID, we used to have families with us, and I would talk to the dad during the visits or talk to the partner so that I could prepare them too for the pregnancy. And now we do what we can to call them into those visits too, to also mentally prepare the partner for what they can expect to see throughout the pregnancy and postpartum.